I'd like to remind persons that whether you're young or old, when you consume things like alcohol, you sometimes become a bit of a different person, more of a risk taker, and it will lead you to do things that you wouldn't normally do. So, if we're talking about sex and sexual health, I would like to remind persons to, first of all, be proactive and carry your condoms with you. If you find yourself in a situation and you are under the influence of substances and you are likely to do stuff that you wouldn't normally do, for example, a sudden sexual encounter, you want to ensure that you have some form of protection to do so. And plus, you wouldn't like yourself to be in a situation where your partner says, I don't have a condom. Hey, you can show them the condom, so that issue about a condom is not there. But I also want to take the opportunity to tell persons that we have something called pre-exposure prophylaxis. The shortened form of it is called PrEP. And PrEP is 1 pill a day, can help keep HIV away. It will not protect you from other sexually transmitted infections like gonorrhea, chlamydia, syphilis, etc. But it is one step to reducing your risk of getting HIV from unprotected sex. I want persons to think of safe sex like health. Okay, so we hear about good oral health, we hear about practicing good nutrition, we hear about heart health, skin health, eye health, your mental health as well. So sexual health is an important part of your health. If you think there's something wrong, you become anxious, you want to get tested, you want to know what's going on. So I want everybody to, first of all, ask yourself this question. When was the last time I got tested for a sexually transmitted infection? I am sexually active. When was the last time I got tested for a sexually transmitted infection? Things like HIV and syphilis, you can get tested for very quickly. 15 minutes, you can get your results, right? I want you to think, do I practice safe sex? Like, do I use condoms? Who do I use condoms with? Do I have more than one partner? Do I decide which partners I use condoms with and why? So, I'm gonna make you think about something. Everybody has a past. Unless you come into a relationship without having any prior sexual relationship, put that aside, everybody has a past. So, the one person that you're having sex with now, you're basically having sex with everybody else that they have had sex with in the past. And likewise for them, when they have sex with you, they are having sex with everybody else that you have ever had sex with, right? So when you think about safe sex, you're protecting yourself, but you're also protecting your partner as well. Yeah? I will go back to condoms, barrier contraception. That is a good way to protect yourself from infections. I mentioned PrEP earlier to help protect yourself against HIV, but you still need the condoms to protect you from all the other things, the syphilis, the hepatitis B, the chlamydia, the gonorrhea, whatever else is out there. Yeah? One thing else I will say, when you may have one-off encounters, we understand that, and I've already said, carry your condoms, be proactive so that a situation happens, you have the protection available. If you are engaging in a long-term relationship and you want to, continue on with that person, I would suggest, as partners, you both get tested. Yeah? You get tested for HIV, syphilis, etc. And share your results. Be open. So everybody knows what page you're starting on. Yeah? Somebody has HIV, they can have a healthy sexual relationship. That's why we have condoms. That's why we have pre-exposure prophylaxis. So things can happen out there. If you have a sexually transmitted infection, doesn't mean that you can never have sex again. You need to speak to your doctor and understand what is out there for you, how you can be treated, and how you can engage in a healthy sexual life.